Hi guys, welcome back to Relentless. I recently had the opportunity to sit down with Dr. John Bartemus and talk about a myriad of health issues. And it's kind of hard to keep these interviews to just 10 minutes when there's so much good information, but I hope it's helpful to you. We had many topics that we discussed, but first I wanted to give you his background and encourage you to always make sure you do check on the training that the people that are giving you your health information have. Because you want to make sure they're truly trained, they've taken the time to get the certifications and licensure that is needed to give you the best care possible. So Dr. Bartemus, he is a self-described health CSI agent whose goal is to put together your clinical puzzle. He doesn't look at you as a population study. He looks at you with your symptoms, your history, and how you're presenting with what you have. He is he's a certified functional medicine practitioner. He is board certified in integrative medicine. He's a member of the International Association of Functional Neurology and Rehabilitation. He is a member of North Carolina Integrative Society, member of Paleo Physicians Network, and he owns and operates Functional Medicine Charlotte in Cornelius, North Carolina. So he has a very good lineup of pedigree in this industry and someone that we should listen to and learn from his vast knowledge of the body. So I hope you enjoy this interview. As always, comment below with any questions and continue on your pursuit to be relentless in finding true health and happiness. Thanks. We are back again with Dr. John, and we have some great but kind of frustrating conversations to have, especially with what we do every day. We meet clients, and the wide world of web is wonderful, and we can learn a lot, and there's so much great information out there for us, but sometimes it can be, I don't know, how would you say, frustrating. So we have a lot of clients that are self-treating and self-medicating, and may have a friend in the industry and they can get them a drug or a treatment on the down low, and that's just not a good idea. So a lot of times people will see a video or a news show or a prominent doctor that knows what he's talking about, but suggests a product, and a person will run out and get that product and take it, and they don't know what they're doing to themselves. They don't know what the side effects may be. They don't know if that product is going to work at all, because that product may be a good product, but it also needs this other ingredient or mineral to go with it to absorb into the body to even be effective. So talk a little bit about what you see every day, because I'm sure you have clients that are patients that come in and they have a plethora of things they're taking and they think they're doing a really great job, but overall it's really detrimental or just not helping at all.
Yeah, so it's not uncommon for someone to come in with 2 Harris Teeter bags of Nature's Way supplements and thinking they're doing a good job, and they're doing their best, but ultimately what you're describing is the Dr. Google phenomenon. You know, so they see the Dr. Oz show or whatever, and they jump on and say, oh, astaxanthin, that's the sexy supplement of the week. They order it. But the problem with those shows or the blogs is that, or a book even, when you're writing a book or a blog article or recording a show, you're making a statement based on a population, right? So in general, is the paleo diet great for America? In a general sense, absolutely. It'd probably help America a lot if everyone did it, but there would be people hurt by it.
Right.
So when you dial down to the individual in front of you, the thing that everyone would agree is healthy may be the worst thing for that person. So taking a recommendation from a TV show and applying it to yourself, unless you are working with someone that really knows your case, that could be the wrong thing for you. For example, flu season, right? In the office recently, people are asking about flu season. What are some natural things we can do to combat the flu and not get the flu shot and that sort of thing? So one common herb suggested is elderberry, and is it safe, et cetera, et cetera. So again, in general, elderberry is safe. Research studies have shown its effectiveness against influenza A and B. I did a little video on that if you want to check it out on YouTube.
That was a good one.
but basically, again, it comes down to the person in front of me, because elderberry's function in helping you fight the flu is ramping up the inflammatory response of the immune system. Mm-hmm. So in a general way, yes, elderberry is good for you to fight the flu, but in the specific person, if it's you and you have autoimmune disease, you're walking in pre-inflamed, right? So if then I now dump in elderberry, which drives that inflammation higher, we could drive you into an autoimmune flare trying to fight the flu.
Right.
Okay, so that's where working with a professional who knows your case inside and out and knows the nuances of these things can say, you know what, elderberry is probably not good for you, but how about some lauric acid or some berberine or some lemon balm? You know, if you know the nuances of those different things, they may be a better option.
Right. And that's why I cannot stress enough to find someone that looks at your body as a whole. Not, this is a great product, take this, because that doesn't always work. Another thing that we have to consider is, if you can get those supplements, buy one, get one free, or like a package of 5, probably not good quality. So talk a little bit about the ingredients of some of those cheaper things. And I know like the adjuvants or the packaging or the things that make them be able to stay on the shelf for a long time. The things that are, like the beginning product may be great. It may be a great mineral or a great vitamin at the core of what it is, but then the way that it's packaged and sold ends up being a problem in the end, or it could sit in the body and not process. So talk a little bit about what is in those ingredients.
Yeah, so a couple of years ago, there was a study done by a third party that went to Target, Walmart, GNC, and bought supplements, and they said, we're going to study, is what's claimed on the label actually in the supplements? And the vast majority showed that there was a lot of things in there that weren't on the label and can be damaging, and that there were very, very minimal amounts, if any, of what was claimed to be in there in the products. So there is a difference between a practitioner provided supplement and a market store provided supplement. To answer your question, a classic case is fish oil, right? Everyone's aware they should take fish oil. Commonly, people come in, what brand do you take? I take Nature's Way. That's on the shelf at our grocery stores and superstores. And there's a difference in quality. So a common response would also be, hey, I've taken fish oil and it makes me burp, or it has fishy taste, so I don't take it anymore. Well, that's a key sign of an oxidized product or a poor quality product. So a quality product shouldn't cause you to burp unless you have gallbladder issues and fat emulsification issues. So that could be a sign of, hey, you need to look deeper here. So if a supplement works or doesn't work, if a medication works or doesn't work, that's a clue about your physiology. So we shouldn't say, oh, that didn't work for me, no good. We should say, what's that telling us about that person's body?
What is that communication your body's giving you?
And where do you need support? Right? Because if you're not absorbing your fish oil, you're probably not absorbing your avocados and the coconut oil that you're cooking with to be healthy and all these other good choices you're making. So it's very important to use quality products and know how to use a product. So again, a fish oil is oxidized or basically ruined by light, heat, and air. So if you have a liquid fish oil product and you open it and take it and then leave it out on the shelf for 15 minutes, you probably just ruined it. So knowing how to use it, how to dose it, the quality to look for is very important.
And we'll go back to our previous video was about muscle relaxers and stuff like that. And one thing I hear a lot of is, I was hurting really bad. I just couldn't make it through my day. And I had a muscle relaxer from an accident I had a couple years ago. And so I just took that. I'm like, no, we don't take things that are expired, generally speaking. So why would you do that? So what you're taking is so important, and long-term can create a lot more problems. So again, I go back to working with someone who can look at what you're taking combined with your body's expression of pain or whatever it has, and see how it best work together.
Another thing to piggyback onto that is, okay, say you're getting what you think you're getting from the supplement. Well, then under the label is other ingredients, and oftentimes in there's binders and fillers that can be toxic or hard for your body to process and inhibit you from getting the benefit you think you're getting. And oftentimes medications have modified cornstarch or gluten as part of the binders and fillers. So if I'm taking, a classic example is, if you have thyroid Hashimoto's is highly cross-reactive with gluten. And so in the past, thyroid medications have had gluten in them as part of the binder and filler. So you're actually, when you take your T4 hormone, you're actually pouring gas on the autoimmune fire because of the binders and fillers in that drug. So there's important nuances that need to be known to live the life at optimal that we're seeking.
Yes. It's that the key point here is do not self-treat. And if you're taking something, make sure it's given to you by someone who sees the big picture. Another thing that's really popular these days, and I see a lot of being in the gym a lot myself, is men self-treating. So a lot of times we talk about women, we know we have hormone issues and postpartum depression, things like that. So women, it's easy to talk about our health care, we know it's important, but I think men get left out a lot, especially as they reach that 40-year-old mark and they start to see changes or feel changes. They don't feel as comfortable talking about them or getting help. So they start self-treating because they have a doctor friend that can get them some testosterone, or they start taking a lot of testosterone supplements over the counter. So give us a little rundown. I know that's a broad topic and, you know, we could spend hours on it, but just, again, encourage our listeners to be aware of what self-treatment can do in those situations.
Yeah, so the low T phenomenon is huge right now. And basically what happens is a guy feels fatigue or lack of motivation or decreased libido. He hears or is seen on TV or a blog, hey, you probably have low T, goes to a low T clinic, tests low, and receives testosterone treatment. The problem is that in the low T clinics, they're not assessing the hormonal system as a whole. And so oftentimes they'll run a total testosterone and a free, and even sometimes just a total, which is poor, really poor. But if you're only running the total and the free and not looking at estrogen and some of these other markers, then you're not getting a full picture of what's going on hormonally. Why is that important? Well, some men convert their testosterone to estrogen, and that's why they have low T. In those men, giving them a testosterone injection is basically giving them an estrogen injection, because you give them the testosterone, their body converts it to estrogen, and you're off to the races with what they call gynecomastia or man boobs, weight deposition around the weight, and further fatigue, depression, crying at commercials with puppies on them.
Which is okay. I'm not saying that's bad.
So again, as you teach and I teach, looking at the system and the body as a whole, and oftentimes if you're having hormonal dysfunction, it's not, the hormone pathway isn't the primary deal. Oftentimes it's these other pillars, like looking at gut and liver and inflammatory status and blood sugar. That's really the key to helping these men. Right.
So again, it all comes back to, you can't separate out one system of the body and just treat that and it be okay.
Right.
Because just like in body work, and I tell my clients every day, everything is connected. Your ankle could be causing your shoulder problem. So again, it's getting back to looking at the body globally. I say that all the time because everything is connected. Every symptom you have, that's there for a reason. It's your body communicating to you, just like a baby cries. So suppressing a symptom isn't going to give you long-term relief. So if you have issues, you're taking supplements, you think you need to take something, speak with a professional that sees the body globally and ask questions. You know, people walk into a doctor's office and they say a couple sentences and they get a prescription written right away. And there is absolutely no foundation most of the times for what they have that they're taking.
I think the statistic is in mainstream medical offices, the patient gets to speak 12 seconds before they're cut off.
Right.
So, and the average visit is 8 to 12 minutes. So it's really hard to assess the whole system in 8 to 12 minutes.
Exactly. So just, again, being very aware, it's your body, it's the only one you have. We take better care of our cars a lot of times than our bodies, and that's not how it should be. So if you're taking anything and you have questions about it, if you think you should take a supplement, you know you're low in something, you may have had a test that showed that you were low in something, please get with Dr. John or someone similar in his profession and find out how to truly be healthy. Thank you. So I hope you enjoyed that interview with Dr. Bartemus. We will definitely be having him back for more information on more topics. If we happen to miss a topic that you're interested in or are having an issue with, please always leave a comment below with some situations that you're dealing with, and we will always be happy to have Dr. Bartemus back. Thank you so much. Have a great day.